Good evening. My name is Giancarlo Levano, and my final presentation on this PowerPoint, I will be talking about chronic kidney disease for my pathophysiology class. What is chronic kidney disease? Chronic kidney disease is a gradual loss of function of the kidneys. Kidneys filters waste, the excessive fluids from our blood, and these then excreted in the urine. As this disease advances in stages, dangerous fluids build up in our body. As the stages of the disease gets worse, you may develop high blood pressure. Will also develop anemia, weak bones, nutritional health, and nerve damage. This disease also increases issues with heart and blood vessel disease. The causes of chronic kidney disease. This disease may be caused by diabetes, caused also by high blood pressure or other disorders. As disease progresses, it may also lead to kidney failure, requiring dialysis or transplant to maintain life. Facts about chronic disease. 37 million adult Americans have chronic kidney disease. Heart disease is a major cause of death with people who have chronic kidney disease. Hypertension causes chronic kidney disease, and chronic kidney disease causes hypertension. Protein in the urine means chronic kidney disease is present. Risks of chronic kidney disease. High risk groups include diabetes, also family history of kidney failure. African Americans, Hispanics, Pacific Islanders, American Indians, and seniors are at a higher risk of this disease. Symptoms to chronic kidney disease. Although most people may not have any symptoms until disease is advanced, you may notice loss of energy, poor appetite, sleep disorder, muscle cramps, swelling feet and ankles, and need of urinate, often especially at night. Chronic kidney disease affects the urinary system. When kidneys make urine, it flows down the ureter and empties directly to the bladder. As bladder becomes full, it urges to urinate. People with chronic kidney disease urinate lots of water fluids, but no waste products in the urine. Kidney's ability to filter waste products decline as chronic kidney disease progresses. Complications of chronic kidney disease. The complications that chronic kidney disease can lead to are pulmonary edema, cardiovascular disease, hyperkalemia, pericardium, and end-stage kidney disease. What is pulmonary edema? The main cause of pulmonary edema is congestive heart failure. This causes pressure in small blood vessels of lungs, making this to leak fluids from vessels, depriving oxygen in bloodstream and the body. Also, pulmonary edema. The conditions that can cause this pulmonary edema are pneumonia, lung damage, and this by severe infection, complications in heart valves, and heart attack. Symptoms to pulmonary edema. The difficulty of breathing, shortness of breath, weight gain, especially in the legs, fatigue, and wheezing. Cardiovascular disease. This is when blood vessels are blocked, leading to the heart attack. Cardiovascular disease also affects the chest pain and lead also to stroke. The effects are in the heart muscles, valves, or rhythm. Cardiovascular disease risk factors. Men are at a higher risk to cardiovascular disease. A family history, obesity, physical inactivity, stress, poor diet, smoking, and not washing regularly the hands, which this means poor hygiene. Cardiovascular complications. Heart failure, not pumping enough blood to the bloodstream, heart attack due to blood clot blocking blood flow, stroke when arteries to brain are blocked and not enough blood reaches the brain, aneurysm, and this is when a bulge of wall is in the arteries. What is pericardium? This is a sac that protects and lubricates the heart. Complications occur when pericardium gets inflamed with fluids. Swellings can affect the heart and its functions. Pericardium protects heart from infections spread from any organs and system. Pericardium causes. Pericardium cause can include a trauma, such as heart injury or chest, health disorders, such as a kidney failure, tuberculosis. Medications can lead also to this disorder. Systematic disorders, such as lupus and rheumatic arthritis. Pericardium complications. These include people with this disorder can develop permanent scarring and pericardium contraction. Cardiac tamponade can develop due to excessive fluid. If not treated properly, it can be fatal. Chronic kidney disease treatment. Depending on the stage of the disorder, treatment may vary. Some may need dialysis to help replicate kidney function. If the chronic kidney disease is at an advanced stage, kidney transplant may be necessary. Another help, it could be try to stay as healthy as it can with a lifestyle change, exercise, good diet, good hygiene, not smoking, and avoiding incorrect medication. This is an image of the cardiovascular disease image, which shows is dizziness, shortness of breath, palpitations, and chest pain and discomfort, as well with another picture here of the chronic kidney disease, which involves everything around, which could be concomitant, which is diabetes, high blood pressure, heart problems or stroke, obesity, family history, tobacco use, and over the age of 60 years old in the male.